What's up, social media? It's Dr. Steve. One of the greatest tragedies in science is the slaying of a beautiful theory by an ugly fact. And that's that your doctor is not able to address your orthopedic issues like sometimes they say. And they don't know what to do, and they just tell you, well, it's genetic, and they just don't understand, and they haven't had the proper education to know how to help you. And so we all have these 26 bones, and as we all age, a bone will slide forward, like so. Here's our illustration, slides forward, and we don't have muscles that attach on the back of these spinous processes that can pull that backwards. So if that slides forward due to gravity, muscles then have to pull back and compensate to basically hold your body up. Muscles shouldn't have to hold your body up. So if this slides forward, it goes forward and rotates in your body, eventually it starts getting tangled up. Fascial tightness, restrictions, and so we get these joints sit abnormally. And you're told, well, you have arthritis and there's nothing we can do. And that's just not the case unless you're severely gone. But even in that case, we've seen things that have regenerated, and I'll show you guys some images in a little bit. But basically, when those bones go forward, like so, we have to figure out how we're going to get that to go back. And so when that bone went forward, it basically have a cord that goes through the middle, and that rubs and it thickens. So when that cord thickens, it restricts movement, and the joint starts to sit abnormally, and it wears. Now we got arthritis, we get tendonitis, we get bursitis, we get injuries, and we need to address that. So we have to basically pull apart those calluses that have developed, and then these bones that are stuck forward can slide right back in like a hot knife through butter. So the end process, and I'm going to show you guys what this looks like, is here. So here's a patient that had bulging discs, right? And so they came in, and you can see here how there's no disc left. And 12 weeks later, we actually have heightening of that disc occurring. So that's one case in just 12 weeks of how that's improved. Now, they're not 100%, but it's improved. And then if you look at this person's knee, they're like, oh, here's bone-on-bone arthritis. Well, this was no surgery, right? And look at the difference between that image before and this image 12 weeks later. So the results speak for themselves, the images speak for themselves. You don't necessarily have to have orthopedic surgeries and knee replacements and things of that nature. You can do things naturally if you apply the right science. You can reach out to me at protouchrehab.com, and you can follow me on YouTube at Dr. Steve Spencer. All right, I'll see you guys soon.